Yeah. So, so what are some of the solutions that the CMA is advocating for? Because we hear a lot of dates and numbers. We're going to throw this much money at it. We're going to be, by 2026, we're going to be fine, or 2030, we're going to be, happy. Everyone is going to have a physician. But realistically, what are the things that need to change in order for some of these to be accomplished, for everyone to have a clinician, primary care
Yeah.
clinician, or access to a clinician?
Well, like I just said, when you're 23,000 physicians short, we're not going to have a one solution that fixes the whole problem. So we have to be working at every different angle all at the same time. So that means increasing class sizes, so medical school residency spots. Now that's going to take years because the average family physician has 10 years of post-secondary education, but still, so that needs to be happening. But we're not going to be able to train our way out of this. So we also need to be facilitating international medical graduates, those doctors who are already here, want to contribute, facilitating getting them safely into the system so that they can participate in providing care. That's really important, especially right now with what's going on in the US, facilitating US doctors who want to come to Canada. There's a lot of interest. We're hearing a lot from American physicians, so that's a big one. We also need to be doing things like team-based care because there's a lot of things that could be shared amongst a team and sometimes done even better by other team members. I think of my own practice where I saw mostly prenatal patients in a clinic, but we had a dietitian. And so when they had gestational diabetes or pregnancy related diabetes, they could spend time with the dietitian going through a low cost diabetes friendly diet. And then they would see our pharmacist, because we had a pharmacist as well, who would teach them how to use a glucometer to check their blood sugar. Like that was a much better service than I could provide. And it took that weight off of my plate so I could see other patients and deal with their medications, their blood pressure, whatever other more complex issues they may have. So having that team environment helps us take on more patients, decreases the stress for physicians, which makes them less likely to decrease their hours and leave for other things. And we work better together when we share expertise. I also want to see us decreasing administrative burden because family doctors spend, depending on which research you look at, 10 to 19 hours a week doing paperwork. So, that's several days of paperwork in some cases a week. And if we can get rid of that, maybe through AI scribe, maybe through reducing some of the forms that we shouldn't have to fill out as physicians, or getting rid of sick notes. There's a lot of things we could do that could bring that number down and help us see more patients. But the key is we have to work on all of these things at the same time. No one of them is going to bridge that gap. And so we need to work at all levels of government where we have control to make an impact.